This is Selma Schimmel for the group room in Chicago for the ASCO meeting, where our discussion continues with so many of the physicians kindly taking time out to be with us. And right now we're joined by Dr. Lidia Schapira, who is a breast medical oncologist at Massachusetts General Hospital, where she is also assistant professor in the Department of Medicine at Harvard Medical School. Welcome.
Thank you.
Do you think there's an opportunity for the patient advocate community to be involved in more cultural sensitivity efforts and training to do outreach?
Absolutely. It's a wonderful opportunity. We're never going to keep up with understanding all of the different cultural mores of our, for instance, new immigrants, because we are a country that keeps seeing different waves of immigrants. So whether it's faith-based, language-based, cultural and traditional-based, we constantly are falling behind or falling short of what our knowledge base is. So we need new models for this. And one of the models would be to bring in people, whether you call them navigators, advocates, whether they're coming from a community setting or they're coming from within the professional community. Absolutely, it's necessary to have cultural brokers, language brokers, and advocates, somebody whose job it is to make sure that the patient has enough information to participate and to actually give an opinion on her or his own care.
Well, it's interesting because in the United States it seems like we go through periods where there's an influx of different cultures. I live in Southern California, and so I'm seeing the demographics change and looking around thinking, well, when I was younger, there was a real Latin influence, and then we've had the Persian, the Iranian community that has, very different ideas of how their safety is, or the Armenian culture, and now we have the Russian culture. And I'm looking at all these groups, and it's true, each one of these groups that surround me in my own city sees their role in healthcare differently, who they want to access and feel safe with differently. In some cultures where the family won't tell the patient they have cancer and will tell the doctor, do not tell. And we saw this a lot in the Armenian and Russian culture. Do not tell my mother that she has cancer. And I always sit back and think, patients aren't stupid. We know, I don't care what culture you come from, we know when there's something serious going on in our bodies and how complicated it has to be when you're dealing with a culture where you can't be honest with the patient. And that always troubles me too.
Yes. I think it's a brilliant point, and this idea of, please don't tell my mother has been for years one of the classic examples we've used in communication skills training courses. I mean, my interest in this also comes from the fact that it's been sort of my dear cause to help oncologists better understand their patients. So I'm coming at it mostly from the educational perspective, and perhaps the first person who got me started was a patient who was an anthropologist. So I was very interested in, first of all, understanding how our medical culture was perceived by patients, and then trying to find ways of helping physicians communicate. In general, this idea of don't tell my mother and all of the cultural ideas around truth-telling has been one of the main nuggets of all of the cross-cultural communication courses. And I can give you examples of films or my own practice that I've used over and over. I think the big thing is this. Once you've had some training in communication skills, and if you are, again, humble and curious, this idea of how you can help a patient, again, is an example of all of the cultural barriers and hurdles you have to jump over.
And you have to help the family.
You have to help the family, and that is the first part of what I call the strategy. The first thing you do is you say, okay, here, where is the locus of decision making in this family?
Right.
Who are the stakeholders here? And is everything based on just love and trying to protect each other? If everything is pointing in the direction that they're all just functioning differently, but they're loving each other, it's not a matter of secrecy, it's just a matter of buffering or protecting, then anybody who's skilled and tuned into communication can figure out an approach where you'd have to develop rapport, for instance, with each family member, make sure that they understand that you're there to help your patient, that you and your patient can also communicate freely. And in the end, in my 20-plus year career in oncology, every time that's happened, we tore down through these walls, and we ended up communicating and feeling that, you know, we diffused the tension, we avoided frustration, and I was able to guide these families to understand that what they really needed to do was to be supportive of each other. And in an atmosphere of secrecy, it's much harder.
How do you help someone from another country or another culture feel like they can be safe within our healthcare system?
Absolutely. The issues of trust, mistrust, and distrust are some of the real problems that we address, again, in any cross-cultural communication curriculum. And there's plenty of data for that, even in our own country, that there are some perhaps self-defined ethnic groups that trust to different degrees, you know, the physicians or perhaps members of the medical establishment. Trust is a process, and you have to build and earn trust by basically showing up on time, delivering what you say you're going to deliver, and having, again, an attitude of complete respect and openness with the person that you're trying to help and serve.
It has to be very emotionally frustrating and sometimes sad for doctors who may not be able to reach their goal with the patient, knowing I could really help this patient, but if culture is the obstacle, and sometimes there must be some real reality checks that are necessary for the physician not to impose his or her value, and you may not always win your battle to reach a patient, and that's not a failure of the physician, and there has to be a degree of forgiveness and acceptance that you're not going to be able to reach everybody.
Absolutely. And there perhaps can be also some new rewards in having at least made the effort. So again, you know, we're back to this idea that you can be enormously skillful and very, very smart, but without some humility and some idea that this is a profession where you are of service to others and a willingness to negotiate. You know, this kind of work can seem incredibly hard, but if you come at it with the right attitude and you have some basic skills, it can also be enormously rewarding.
I think what you're doing is fabulous and important, and what a gift you're giving not only to patients but to the next generation of doctors.
Thank you so much.
Thank you so much to you, Dr. Lidia Schapira, who is a breast medical oncologist at Massachusetts General Hospital, where she is also assistant professor in the Department of Medicine at Harvard Medical School.